feels that way, doesn't it?
It sure does. We haven't been down this path.
But I mean, we did do our last video of groceries. We did one of our groceries. I have a few more to put on there, which I think are beneficial not just for our viewers, but for us. It really highlights to us the foods we're eating. We're trying so hard to become more health conscious, as we both did go to the ER for similar type symptoms.
Right.
And we're making the rounds of all the doctors. We're getting to know all the specialties.
Every doctor wants a hand in there.
We just came back from the pulmonologist for my sleep apnea, which Steve and I both have, and we've never had any doctor tell us to follow up and keep in touch. And this doctor wanted me to come back in 6 months, even though she said I'm doing great. She got the report off my CPAP and said my apneas, I think they were my apneas, weren't they? That were 7, and if you have under 5, you don't even have sleep apnea. And I said, well, then you mean I'm close to getting rid of my machine? And she said, no, I won't go that far.
No, you have to keep coming back.
And I said, okay, well, you don't want to see me again. She goes, oh, I do want to see you again. And I thought she was kidding. And she said 6 months. If I see you in 6 months, I'm like,
6 months.
Why?
Yep, 6 months.
Why?
You know, yeah. Correct me if I'm wrong in the comment section. But I'm just of this feeling that this is all about money. You know, some people are sick, and I give you that. Some people are sick, and some people need it on a regular basis to go to doctors and have themselves evaluated for what their medical conditions are, and if they're getting worse, to take care of them. But you know, we're pretty healthy. I mean, we're overweight, granted, not a ton of overweight, but we are overweight, and we do eat salads, healthy salads every night, and we spare the dressing on them. But the salads are made up of usually spinach and celery, carrots, cucumber, you know, so it's healthy things. And so it just concerns me that we go to a cardiologist a couple days ago for my follow-up, which I don't like doctors or hospitals, and the cardiologist was pushing 4 different tests along with different medications. And if you research the medications, you see that there are these tremendous side effects. Now, I had taken statins for 20 some years because I had high cholesterol at one time for a period of time. And so I took statins until I started to really, the side effects from it, my muscle aches and joint pain, just really got to be too much. And then I stopped taking them, and my numbers stayed about the same, so that really wasn't a concern. And then recently, when I had gone to the hospital, I had my blood taken, and my LDL was very little bit elevated. My cholesterol was in a good spot. HDL, triglycerides, all that were good. But so this cardiologist focused on that and wanted to put me on a statin. And when I said I didn't like statins, then they offered me this drug that you inject in your body every 2 weeks. And, you know, I thought about it, and I thought, well, that could be, you know, that could make it, you know. But then as Sue started to research some of the side effects, and I went to the store to tell them I wasn't going to, I was thinking about it, you know, and I said, well, how much is that going to cost? And they said, oh, $2,000 every month. You know, and I was like, $2,000 every month? What are you, crazy? And so it really, I told them I didn't want that without really hearing what the side effects were. And Sue had told me the side effects were diabetes was one of the side effects.
Well, let's back up a little bit. When Steve had his appointment, his follow-up from the hospital, I also had an appointment, but I couldn't get an appointment for a month out. And so I mentioned to her that I had also been to the ER for kind of the same symptoms, that we're both labeled TIAs, but it's not necessarily accurate. That's why it's very important to get proper diagnosis. Neither of us really got a good diagnosis,
Right.
especially me. Mine was different,
Right.
but we haven't gotten into my story yet. But anyway, she said, I will see you today. I have 2 patients, and then I'll come and see you. And I told her that the hospital gave me 80 milligrams of, it's the Lipitor generic, which is, what is it called?
Advostatin.
Adverstat?
Adverstatin.
We'll put it on the screen.
Something like that.
But it's 80 milligrams. Well, in our round of doctors, we go together, and even the doctors all have an opinion. And so when Steve went to see the neurologist, he told me 80 milligrams is unheard of, and that causes bleeding.
Stomach bleed.
And, yeah, and I don't think I've ever seen that online or in my research that it causes bleeding, but he that's a very, very high amount. And in all my research, and I know they say don't go to TikTok, YouTube.
Yeah.
I've gone to Reddit, people have been on it. And actually we've gone to the real medical sites, the government sites. And most doctors will start 10 to 20 and work up to see that you could tolerate it.
Yeah, see how you tolerate
So
it.
starting at 80 right off the bat, you're
Right.
probably going to have the major side effects, and that's
Right.
what happened to me. I had every side effect from,
That
and I
was
didn't,
crazy.
and I didn't research them, and I didn't even pay attention. At first I thought I wasn't having any,
Mm-hmm.
but I noticed falling asleep at the dinner table, and I was like, "What is happening to me? I'm falling asleep talking to Steve. What's up with that?" I did that, and then I started to have severe muscle pains and a real bad reflux, which I haven't had in at least 10 or 15 years. It's like, why am I having reflux? Started having all these really, really bad side effects. And so I told the cardiologist, I said, I cannot handle statins at all. I need an alternative to a statin. She said, well, we've got this great, wonderful shot that's just twice a month. And I think technically maybe it's not a statin, it's Repatha. I don't know what technically, we're not doctors, we're not medical people, don't listen to us. This is our personal experience. We're beyond confused at this point. We don't know what to do because
Wow.
because the doctors imply if we don't listen to them, we will be dead. One doctor
Right.
actually told me if I did not take cholesterol pills and high blood pressure pills, I would be dead in 5 years. And it's been 3 years since she
Right.
told me that. And I think of that in the back of my head. That's just caused me tremendous anxiety.
Yeah.
And I don't have high blood pressure.
Right. And so, it is very confusing, and we are not doctors. And, that's why I say, this is my own opinion, is that if it is way too confusing, then don't do anything for a little while and just watch your symptoms and keep an eye on it. And if it continues to get worse, then you do want to do something. But if you watch it and you invoke, in this case, diet and exercise, then your numbers should improve. And if they do, then statins weren't the answer.
Well, my cholesterol was higher than Steve's. Overall is high, and the LDL is high. But when we got home, I Googled a lot, which I wasn't supposed to do, right? I'm not supposed to know. But it said to look at all these ratios. That the Framingham study, which is the largest cardiac study, it said that they found that the ratios were more indicative of who would not have a heart attack versus LDL alone. So my ratios were all good to outstanding. So she never mentioned ratios.
Right.
And then other sites said that cholesterol is just one part of the metabolic panel. You should look at your blood pressure, your insulin resistance, your exercise, your stress, and your weight. Yeah, we are overweight, but we do exercise, and our stress is a little high. But there's no guidance that says, hey, if you lose 5 or 10 pounds, you could actually get these numbers down. We're both not even pre-diabetic. We're both totally normal with blood sugars. And statins, one of their biggest side effects is high blood sugar. And when I Googled this Repatha on the site, the medical drug site, the first thing that really popped up that I saw said common side effect is high blood sugar or diabetes. I'll put a picture here because I took a screenshot because I just read it like 10 times. I'm like, am I reading this right? Common to me is means a lot. That means you have a high chance of getting it. So blood sugar, having good blood sugar is preventing you from having a heart attack and strokes. And so this medicine is supposed to prevent you from having heart attacks and strokes. Is going to give you high blood sugar. That's going to give you a heart attack and strokes. So I'm more than confused.
Right, exactly. And if you look at ratios, and some doctors tend to go by ratios, we're both in a pretty good range. So, I mean, we're going to continue with diet and exercise, and we'll see where that goes. But if you have found similar situations where you have been prescribed a medication to take care of a situation, now just remember that when your blood is taken and your cholesterol is measured, yes, you did fast, hopefully. Then this is just a picture of a stitch in time. If you were to take your blood and test your lipid profile every week for a month, you would find different numbers. You would find numbers that go up and numbers that go down. So my whole thing is that the blood test, the lipid, if your hyperlipidemia is high, or your hypertension, it test it over a month and see really what that true reading is. Because you'll find that, at that one day that it was taken, I had some meat, some steak and cheese, and some big desserts, and so my sugar's going to be high. Even though I fasted, it's still in my system. And, you can't really judge everything on that test.
So Steve's saying that because we had our physicals in February, and he went to the ER in April, and his numbers were quite a bit lower in April, right, at the ER?
Right.
Versus the doctor. And the cardiologist only looked at his physical from February. She wouldn't even look at his numbers from the ER, which were all normal except for the one LDL that was slightly elevated at 111. But in my research, I saw that it was as recently as 2013 that they lowered these numbers. I have no idea why. I mean, they're saying it's for health reasons, but they continually to lower them more and more and more. And that's including like blood pressure, and videos I see say that older people might need a little higher blood pressure, that it's actually not safe. If you lower it too much, you have that risk of dizziness and falling. And I have been going to a doctor since December for my unbalanced feeling. I don't like to say dizziness. I'm not really dizzy. I'm just a little unbalanced. And so I found out I had Chiari's malformation from a neurologist who did an MRI, and they tried to tell me it's asymptomatic, but I'm thinking, but I have this unbalanced thing. Well, then I've been sent from doctor to doctor to doctor, and I've gone to physical therapy where they've done the Epley maneuver that moves crystals in your ears, and that's helped. And now I'm doing vestibular physical therapy, which is helping with balance and things. And that's out of everything I've been doing, that has helped the most, is this vestibular physical therapy. So I'm going to be doing that for a month or two more, see where I go. And
and here, that's just my point, is that don't go to medication first because it's the easiest. That's what I'm saying. Try, if you can, diet, exercise, different, physical therapy things that you can do. Don't go to the pill.
There's no pill for dizziness. I mean, I haven't been offered, except they say I may have vestibular migraines, and I haven't been able to get to that doctor because it's a 3-month wait. So she probably will have pills for me for vestibular migraines, which may cause dizziness, which is the reason I went to the doctor, was for the unbalancing. So most medications make me dizzy. So getting a statin that makes you dizzy, that makes me fall, it just leads to more and more and more. And so I'm just very concerned about the statin because I had all these side effects. I didn't just Google them and say, oh, there's these side effects. I took it for about 3 weeks and had all these side effects. And then she offered me the shot that the number one side effect was diabetes, and then the same side effects as the statins. They were the same list of side effects and more. Respiratory problems were a big issue. And it said, call 911 if you can't breathe. Well, that kind of scares me. I have anxieties already. So reading that, it makes me anxious in taking these pills. When it says call 911 if this pill causes you not to be able to breathe.
Right. And so, it's just really, if you're really ill and, you can't do these other things, give it a try. I do see that a pill could be your answer, but I'm just saying that there's got to be other things that you can do besides taking a pill. The pills, yeah, they've been FDA approved and they've been tested. And if in the study of 100 people or however many it is, one person has a side effect like diabetes or has a side effect of itchy scalp, then that has to go in the brochure when they sell it as a side effect. But the thing is that I'm not so sold on putting up with these side effects to take care of a problem that could be worked out another way. Because the side effects could lead to other problems that'll lead to more medication, that'll lead to more side effects, that'll lead to more medication, and so then it's a never-ending path, and your money is all going to medication that's causing you to be sick.
Well, I have more issues that I did a calcium score, which no insurance covers that. It's about $100. I did it years ago. And I do have plaque in my arteries, but I am at a low level. So knowing that I have this plaque, that's one reason she was pushing for me to be on statins, because I have this low level of plaque. Most people don't do this test, so they don't know they have the plaque. But at this point, I don't know. I just have to say that, I don't know. I'm willing to take the risk. You have to look at the risk and benefits and the risks of these pills and me falling. Because I fall. Typically, you get pretty hurt in falls. Nobody falls and doesn't get hurt. So if I take the statin and fall, then yeah, it's just not going to be good. So we are in a catch 22? Catch 22. It's a bad place to be, because I'm a rule follower. I typically do what people say, who listen to authority. People who've been trained, I typically listen to them. But statins have always been questionable for many, many years. And what bothers me is my numbers today were totally normal in 1970. And I believe as recently as probably 2013, they would be considered totally normal. And I've seen studies that you should have higher numbers as you age, that you need higher cholesterol because you need it for your brain. So I'm beyond confused. Like I said, I don't know how, personally, I've questioned this since I was a kid, how you do a study and you isolate one variable. That's how you know what changes it. How do you do a study with people? How could you find people who just have high cholesterol, don't have high blood pressure, don't have diabetes, don't have anything else, and it's all equal? Because there was also a study, and I think it was Ansel Keys with the 7-country study. Do you remember that one? Mm. And it was a long time ago. I haven't seen it in years. I've been following statins for, 5 or 10 years since they first started to tell me to take them. And from what I remember is I think he cherry-picked the countries and took out the countries where the people had high cholesterol, but they were very healthy. And just off the top of my head, I don't know if this is true. I thought it was France. They had high cholesterol, but were all healthy. So he took it out, threw it out, and only kept the countries that followed his theory. I've had doctors tell me I'll just give you 3 more days if you take a statin for 10 years, 3 more days of life. But if you're in a wheelchair, or
3 more days.
I mean, who knows? I've seen just recently someone said might give you 90 more days. If I have to not be able to walk because my leg hurts so much from the statin, then I'm not going to exercise. I'm going to gain a lot of weight. I'm going to be on insulin. I'm going to have a heart attack. So to me, I'm like, I'm at this point, I'm willing to just take the risk and just try to enjoy my life. Because I know I had an aunt and uncle who died at 65 or so, which is not much older than me right now. They're both very sedentary. I've seen another lady comment that she's a nurse, and a lot of people say that when people come in with heart attacks, 50% of them are already on statins. And the ones who have serious issues are the ones who are sedentary and have diabetes and things like that. So she's saying sedentary and diabetes was far worse, and she worked in a ER or cardiac unit.
Well, and that's the big thing, is being sedentary. I mean, you can't just sit around. You have to get up and move every hour. And so really it's important that you exercise, even if you're just walking around the block or walking across the floor in your house. You have to get up and exercise, because being sedentary just is not a good thing and will end up in a bad way, because you'll become obese and and that's going to lead to heart problems.
Well, when we went to the pulmonologist, which is not just sleep apnea people, it's any breathing, respiratory problems. 3 people there were severely obese. 3 young women were severely obese. And I know I'm overweight. I could lose 10, maybe 20 pounds. These women were probably 50 to 75 pounds overweight, and they're all young, and I thought they must all have sleep apnea, but none of them had marks. I was like, we have marks all the time from our machines. I thought they must not wear their machines. I mean, they weren't coughing or anything where they have COPD or seem to have respiratory problems. They seem to me like they probably have sleep apnea, which is a high risk for heart attack and strokes if you're not using your CPAP. So I just thought, yeah, and also you gain weight when you don't use your CPAP. Usually that will help you lose weight. But I just found it interesting when we went to the cardiologist. It was filled with people with walkers and canes, and
Mostly everybody with walkers and canes.
I mean, but there was a lot of elderly people, so you wonder, are the statins keeping them alive, or are the statins giving them the walkers and canes? I don't know. That's why I'm confused. I want to do what's right, and of course, I don't know. I don't trust statins because of my personal side effects. Steve hasn't had as many side effects as me, so I've encouraged him, and I've read that men do get more benefits from statins, and he is closer to 70 than I am, so I've said, you could continue yours.
Right, but I also feel that it does give me some side effects with muscle and joint pain. But neither here nor there. I think that it's very important that your own situation is what you look at. I'm not saying to don't take statins at all if they're prescribed. If they're prescribed, take them and try it and see if you don't have. Now, you're going to have side effects. There's no doubt. And I would give it a month and see if you can live with it. But comment in the section below if you've had some good success or you've had many failures with statins or any other medication that's prescribed for a health issue.
Well, we're going to get our blood taken in 3 months as we exercise more, fine-tune our diet, because even though it is pretty good, it's good compared to the American diet, but not great. It's not outstanding. It's good
Right.
for the typical American.
Well, I had slipped there after we had lost some weight. I do most of the cooking, and I slipped where I was cooking with a lot of butter, and we were eating meat on a regular basis and junk. And so, when I say junk, I mean like ice cream and that kind of stuff. And that's not real good.
Well, we bought some ice cream in our video I'm going to put on at Publix, but it's going to be once a week as a once-a-week Saturday night treat instead of
Saturday night?
Instead of every night after dinner, it'll be once a week. Like in the 70s, we were
Right.
lucky to get ice cream once a week.
Right.
That
And
was
so-
our weekend treat.
Right, and so we've incorporated more exercise than what we had. We weren't being sedentary before.
Well, my dizziness has prevented me from exercising. Now that I'm going to therapy, I'm less
Right.
dizzy, and I'm able. there was one time we went hiking, I couldn't even move. I could not even move, so we had to go home because I was too dizzy. Well, now going to therapy, we're hiking 2 to 4 miles.
Yeah.
I'm really proud of myself.
Twice a day. And so,
Well, 4 miles. If we do 4 miles, we don't do twice that day.
Right,
4
we do
miles
4
total.
miles.
4 miles total.
Right, total. So maybe 2 in the morning and 2
Or
in the
4 at
evening.
one time. But I'm proud of myself, and I'm proud of Steve.
Yeah, and I'm proud of Sue.
I'm proud of Steve
She's
too.
come a long way.
I'm proud of Steve to get out there and just keep going, keep attempting it. So, yeah, that's tough, but they say 30 minutes a day. Of course, I was exercising 30 minutes a
Yeah,
day, and
I
that's
mean,
not enough for me.
yeah,
That's
I
not
mean,
enough. I need to exercise.
That wasn't enough for us.
When I
was
lost-
exercising too.
Well, when I lost 45 pounds, I had to exercise
Yeah.
about 2 hours a day. I can't do 30 minutes and lose weight. It's about 2 hours. I don't know why. I have a slow metabolism. So we're going to keep going and see what our blood work looks like in 3 months. And if it is still high, we may reevaluate and
Yeah.
try to take a different type of statin at a lower dose.
Exactly.
I've tried red yeast rice and niacin, and those two also upset me. I do take fish oil already every day, have taken that for 20 years. So I honestly don't know what to do. I don't know what the answer is, and I wish I knew. I wish they said do this. I know a lot of them just guilt me and say you don't do this, you're dead. And I just and they know I have a lot of anxieties. So it's making it worse. As I get anxious over this, that's making my cholesterol get higher because
Right.
your anxieties make your cholesterol go up.
Right. Right. So if you have suggestions that you want to share, please put it in the comments.
And don't say, oh, if you don't take statins, you're dying, or my family member didn't take it and died.
Right.
Because were they diabetic? Were they obese? Did they move?
There's a lot of factors. There's a lot of factors that are involved with death.
Well, I was told today at the pulmonologist, she said, you have a small mouth, you have a high risk for heart attacks and strokes, I believe. I was like, wow. I didn't ask her why, but I was like, oh, so you're telling me I'm already at this huge risk for heart attacks and strokes because of my small mouth.
I don't know. Never heard that before.
Well, when I Googled it, it said it's harder to keep your teeth clean. And if you don't do good cleaning, you get bacteria that causes... It goes into your plaque and causes heart attacks and strokes. So when we were at the cardiologist, I'm disappointed she didn't mention anything other than statins. She didn't mention sleep, stress, oral hygiene, nothing.
Diet, exercise.
Nothing then other than a statin. Nothing.
Right, right. And so everyone knows that, if the plaque on your teeth, it gets into your bloodstream through your mouth, and obviously if you don't brush your teeth and you eat, then you're swallowing and it's getting into your system, and that can cause heart problems. So the bacteria, brushing your teeth in the morning when you wake up, extremely important.
And once you have a heart attack or stroke, they give you a statin for life as a secondary measure.
Right.
They sometimes give it as a primary measure if you're high risk, like we are supposedly with TIAs. But I told the cardiologist, I'm not sure. I know I didn't have a TIA. I was labeled TIA, but mine for sure wasn't. Steve's, we don't know for sure. But she didn't listen. They, like people say, they treat the population, not the person. They have their flow chart and their standards, and even though I'm positive I didn't have a TIA, and Steve actually, I'm pretty sure he didn't either because he didn't fit the mold either.
Right.
But we don't know what they are, so they had to label it something. They didn't say possible TIA, they said TIA.
Right. I mean, when you have lack of sleep and stress on top of that, that can do funky things to you. And I think that's basically where we were both at.
So yeah, stress does a lot to you.
Does a lot.
And it was
It's horrible.
It was stress and lack of sleep. So we're beyond confused. We're not giving advice. We're just saying, I mean, you give us advice. If you could be civil in your advice, go ahead and feel free to help us out. Anything that's a natural thing to lower cholesterol. I know avocados is what my sister told me. And the thing is, my sister's cholesterol level was about as high as mine. Her doctor never even wanted to put her on statins. And she lowered it by eating tons of avocados every day. And it's normal now. But her doctor didn't even notice. Her doctor had no issue with hers being the same as mine. So it's kind of weird how doctors vary in their treatment.
Yep, sure do. So don't forget, comment, subscribe, follow, like, all of the above.
And we'll have some more videos as we continue to
this journey
of life. I mean, we're hoping to someday have some fun days and go traveling. I mean, it's really too hot to travel.
Yeah,
but
it's too hot.
But this round of doctors,
it's crazy.
We're getting to the point where it's like, this pulmonologist, like I said, she wants to see me in 6 months. I said in 8 years, no one's ever wanted to see me again. And we've been taking care of our sleep apnea ourselves. And she didn't say you're doing a great job, but she said that, she kind of implied it, but she wouldn't come out and say it. But, right?
Yeah, and the cardiologist scheduled us for 4 appointments.
8 altogether. No, 8.
8 altogether.
I think 8 appointments. It took us 30 minutes to check out.
It's ridiculous.
3 for me and 5 for Steve.
That's ridiculous.
And it would have been 4 for me. She wanted to do a stress test on me because I was having chest pains, which were new. And I realized after I left there that chest pains are one of the side effects from statins. I was having reflux chest pains, falling asleep. These are all, and dizziness, these are all signs of heart attacks. No, there's side effects of statins and signs of heart attacks. So I was like, all these signs of heart attacks I was having were also the side effects of taking the statins that they had prescribed. So I told her, I'm not doing a stress test. I've done 2 already. I am not doing another. It's a full-blown nuclear stress test. I said, I refuse to do it. I will not do it.
Right.
And so she reluctantly agreed. But she wants us to have our blood taken and come in. First of all, we're going to wear heart monitors for a month, and then come in, get the results, have our blood taken, and come and get those results. And then Steve do a calcium score. She wanted him to do a calcium score, and was sending him to a city so far, far away. I said, we are not going that far away. There's a place a mile down the road. And she's like, but our facility is far away. And I said, we're not going far away. We've been to too many doctors already. So she reluctantly agreed to say he could go to the place a mile away. And that's where it gets to thinking that it's got to be about money. And then what else? She wanted you to do the nuclear stress test.
Right.
And come in every time for every test, come in for every result separately, not all together, but all. And you can't look on the app or the website or have her call or whatever. Well, it's $145 every time I go to see her. I don't have that much money. We're running out of money. We're running out of money with Cobra and co-pays and medicines and testing. So it's getting to the point where I'm just going to have to cancel the appointments. I mean, we had to pick and choose. And I don't know. I don't know what to say.
Right.
We're beyond confused. We want to be healthy. We're trying to be healthy. They were impressed today. I think that we bought our own machines. We keep up with I look at my sleep every day on my machine, how many hours I slept, how many apneas I had. I check that, check my blood pressure every day. I mean, we're doing what we're supposed to be doing.
Right.
Until we see you again.
Take it easy.